to Shri Medical College. Today we will explore optometry and glaucoma, early detection and management. Do you know the warning signs to look for in order to diagnose glaucoma early? Have you experienced any anxiety related to the prospect of losing your eyesight? If that's the case, you need to get medical attention right away. Blindness from glaucoma is the second leading cause of visual impairment in the United States and the world. Glaucoma is a disease that affects the eyes and leads to permanent vision loss and blindness due to damage to the optic nerve. You shouldn't have to worry about irreversible vision loss if you get checked out right away. Glaucoma is the leading cause of blindness in those aged 60 and higher. The collection of fluid in the front portion of the eye is the primary cause of glaucoma, a condition that damages the optic nerve. Pressure within the eye increases, putting strain on the optic nerve. If you have a history of or risk factors for glaucoma that suggest you might have a thinner cornea, your eye doctor will likely perform a pachymetry test to determine your corneal thickness. This evaluation makes use of a tiny burst of air on the eye to roughly determine the interior pressure. When air gets in your eye, it can be a little shocking, but it normally doesn't hurt. The most common kind of glaucoma is open-angle glaucoma. According to data from the National Eye Institute, open-angle glaucoma really constitutes 90% of all instances of glaucoma. The exact cause of glaucoma is unknown, however. It is known that the disorder is caused by pressure on the optic nerve. Until it progresses and causes blindness, it rarely causes any symptoms. Closed-angle glaucoma is a more severe type of the disease that affects a smaller percentage of the population. This usually signals an urgent medical situation. Glaucoma occurs when the drainage of fluid from the front of the eye is blocked by the iris's peripheral edge. If left untreated, the increased pressure might cause blindness within a few days. The root cause of normal tension glaucoma is unknown, despite the fact that it damages the optic nerve even in the absence of elevated intraocular pressure. Although the pressure is within normal range, the effectiveness of treatments to reduce it appears to have been achieved. Iris tissue can be used to remember specific colors. Sometimes bits of these pigments get caught in the channels of the eye's drainage system. When these build up and impede fluid drainage, it's called pigmentary glaucoma. Older people tend to have higher rates of glaucoma. However, the disease is sometimes present at birth or appears in a young child. Congenital glaucoma, sometimes called childhood glaucoma, describes this issue. If immediate attention is given, it should be fine. Injuries that endure more than a few seconds are extremely improbable. Every individual has a unique angle at which fluid drains from the eyes. If the drainage angle is off, fluid will pool in the eye, increasing pressure inside the eye and potentially damaging the optic nerve. Your eyes have built-in mechanisms to keep the pressure inside them stable. Ineffective or blocked natural pressure regulating systems in the eye can lead to glaucoma. The optic nerve is comprised of over 1 million nerve fibers. As these fibers deteriorate over time, blind spots in one's field of vision will develop. You might not notice you have blind spots until many of your nerve cells have died. If every single one of your nerve cells dies, you could go totally blind. The potentially blinding illness can be diagnosed by many ordinary optometrists, but the best therapy is provided by a specialist in the field. Patients have a wide variety of signs and symptoms as their glaucoma progresses through its various stages. Most people experience pain, impaired vision, and blind patches. Later phases may be characterized by severe headaches, eye pain, nausea and vomiting, seeing halos, redness of the eyes, and tunnel vision. To treat your glaucoma, you could start with eye drops. The reduction of intraocular pressure is a typical indication for the use of medicated eye drops. Your eye's drainage system may be improved, or the amount of fluid it produces may be reduced. If your eye pressure is not responding to eye drops, your doctor may prescribe an oral medication to be used in conjunction with the drops. The trabecular meshwork is a tube-like structure in the anterior central area of the eye that facilitates drainage. If a blockage develops, surgery may be required to remove it. It is possible to unblock channels in this system via laser surgery. In a second procedure, tiny drainage tubes may be placed to aid in the outflow of fluid from the eyes. Drops may be used to dilate your pupils if your optometrist requires a good look at your optic nerve. After the artery has been widened, special equipment can be used to get a clearer look at the nerve. Additional surgeries may be necessary to reduce the pressure in your eye if it is too high. An ophthalmologist, an eye doctor trained to perform surgical operations, will talk to you about all the options you have. An optometrist is a medical practitioner who focuses on eye health and vision. They can determine if you need glasses, contacts, or even laser refractive lens exchange to repair vision issues. Optometrists are able to diagnose and treat a wide range of eye conditions, including glaucoma. After you've made an appointment with an ophthalmologist, they'll take a close look at your eyes to check for problems like impaired vision or damage to the optic nerve. An optometrist with further education and experience in glaucoma care should be consulted if the condition is suspected. Regular eye exams that include pressure checks are essential due to the irreversible nature of glaucoma and the permanent damage it does to your eyes. It's best to catch problems early on. Loss of vision can be slowed or prevented, and proper treatment is available. A glaucoma specialist may suggest an oral medicine in addition to the eye drops prescribed by a therapeutic optometrist. The majority of optometrists and ophthalmologists are trained to recognize and treat glaucoma. Diagnosis and treatment of glaucoma are essential topics in optometry curriculum. It is common practice for an eye doctor to check the patient's eye pressure and examine the optic nerve during a comprehensive exam. It is rather easy for optometrists and ophthalmologists to diagnose glaucoma upon first inspection. A common initial step in treating glaucoma is prescribing medication to reduce intraocular pressure. Before prescribing treatment for glaucoma, a professional will evaluate your risk for irreversible vision loss and blindness and the precise stage of your disease. There is less chance of avoiding irreversible harm the longer one waits to receive a diagnosis. Maintaining prescribed checkup intervals is the most effective means of safeguarding eyes and vision. Join Shri Medical College's Bachelor of Vocation and Master of Vocations in Optometry and Ophthalmic Technology and take the first step toward a successful career in hospitals. We are here to assist you in launching your medical career as optometrist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Medical College, nurturing next generation of healthcare leaders and offers all paramedical, pharmacy, nursing and yoga sciences courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Medical College. Good luck, goodbye.